This video is an overview of community and public health organisations and the role these services play in providing healthcare and promoting healthy eating habits. What is the difference between community and public health organisations? Community health organisations comprise of community health services and centres that aim to educate and assist local communities, especially those with the greatest health, economic and social needs. Community health services provide healthcare assistance to improve the health and well-being of community members. Additionally, community health services receive funding from the Department of Health and Human Services. Targeted community health services are most commonly delivered through community health centres, which provide a range of allied health services such as medical, dietetic, dental and mental health. Public health organisations are involved in interventions to improve health and quality of life through the prevention and treatment of disease, as well as the protection and promotion of health of entire populations. Public health utilises initiatives such as the promotion of hand washing and breastfeeding to convey messages to populations. Community health organisations provide communities with a range of allied health services through health centres. Public health organisations provide interventions mainly by way of case studies and health indicators. Community health dietitians work in health centres and are experts in applied nutrition, health promotion and disease prevention. Alternatively, public health dietitians are experts in health planning, setting nutritional standards and developing and implementing nutrition policies. Essentially, public health includes community health, whereas community health informs public health. Both community and public health organisations provide access to all. Community health assesses its effectiveness by way of client feedback and checking annual targets. Public health also checks annual targets and uses policy case studies to assess effectiveness. Inner South is one of Victoria's largest community health services, providing access to doctors and dentists, as well as an extensive array of allied health services and other supports across the inner southern region of Melbourne and beyond. Inner South is a non-profit organisation that delivers more than 150,000 services to community members every year. The overarching vision of Inner South is health and wellbeing for all. Inner South services are offered at any of 4 sites around South Melbourne, Prahran and St Kilda. Inner South provides services from pregnancy through early childhood to seniors, in addition to services for high risk and hard to reach groups. Approximately 280 staff work at Inner South, making for a highly qualified multidisciplinary team. At Inner South, dietetic service delivery sits under community and clinical care. Inner South staff have extensive internal and external relationships with both fellow staff and external providers, such as the Alfred Hospital. Inner South offers services to all, with a particular focus on those who need help the most due to social and economic disadvantage. Additionally, community members can get involved with Inner South as members or volunteers, and can even form part of interview panels for new staff. Barriers to healthy eating habits include homelessness, drug addictions, reduced mobility and increasing age. Community and public health nutrition can work to decrease these barriers by way of one-on-one and group consultations, as well as support groups, all of which aim to increase service availability and access to community members. A culturally competent practitioner is one who is aware of their own cultural identity and views and is able to learn and build on their knowledge and understanding of culture, language and health literacy. Essentially, cultural competency impacts health by reducing or eliminating racial and ethnic disparities, thus improving the delivery of healthcare.
It's preparedness to look to the future and say what can we do differently, what can we do better, but how does that complement, I guess, our fundamental mission of serving people in our local area who are disadvantaged and otherwise would have trouble accessing health services.
Yeah, it's just they've got a good range of services, passionate staff.
Yeah.
I like working with.
Yeah, very good. All right, thank you. Thanks for those questions.